early on, there was a lot of conversation about obviously healthcare providers and those who were symptomatic wearing protective masks. Now the recommendations are coming out that everyone should be practicing
Hmm.
this sort of mask wearing, be it a homemade mask or it doesn't necessarily need to be N95. Can you talk a little bit about that and why or why not that's important?
I think a couple of weeks ago, there was no evidence that the virus was actually being transmitted by air because there was a lot of research going on. But emerging evidence suggests that the virus can actually spread in between two people when they are talking because it can be carried by the aerosol that typically a person sort of exudes when they are talking. That's a normal process. When I'm talking right now, I am actually exuding aerosols, which is basically invisible to the naked eye, but it's still there. And there is evidence that suggests that the virus can be transmitted through aerosols. And I think the CDC has been very, very proactive in telling us now that we need to be wearing masks for this reason. Again, a homemade mask is good enough. And in fact, I would recommend that go to the CDC website. They actually have a do-it-yourself mask making video, which is excellent, and make a homemade mask, especially if you have to go to the grocery store or if you have to leave your apartments. And I would say that especially for caregivers to lung cancer patients who have to go out to sometimes replenish supplies, groceries for their loved ones, I think it's incredibly important that if you're leaving your apartments or your homes, that you use a face mask of some shape or form, and a homemade mask is absolutely fine. And please don't travel. I don't think travel, anything that is non-essential, and in my opinion, most travel is non-essential. If you can avoid traveling, please avoid traveling. And I use New York City as an example. If I, who lives in a COVID hot zone, if I decided to travel to Wyoming right now, it would be highly irresponsible of me because even though I may be asymptomatic, I may be carrying the virus with me to Wyoming. And the reverse is also true. Someone from Wyoming, if they were considering traveling to New York for work, I would completely recommend against doing it because, again, yes, Wyoming is safe, but you don't know what you're going to bring back from New York City. And I think the third piece of travel, which I think is incredibly important to the lung cancer community, is for caregivers. And I'm very, very respectful of the fact that caregivers of jobs that may require them to travel to other cities. But I would recommend that as much as possible, minimize non-essential travel.
A question came in while you were talking about the masks, and it says, in your opinion, would full face shields be more effective for self-protection going out into the stores because it covers your eyes as well?
I think there is some evidence that has come out that shows that the virus can actually infect the conjunctiva, which is basically the layer in the eye. So there is some evidence that the virus can basically infect our body through the eyes. So yes, ideally, if you can protect your eyes, that's great. But we also understand that that's incredibly difficult, and having access to a full face coverage mask is also very difficult. So whatever you have at your disposal, if it just covers your nose, I think that's better than no protection at all.